Welcome to the Occupational Safety Leadership Podcast. This is episode number 109 with Dr. David Duford. Today, Dave and I are going to sit down and talk about indoor air, which to me, of course, in these days, I wonder if we're doing a better job with indoor air type of issues, or because we're just getting cheaper and cheaper things. We're getting things from overseas and different glues and different standards. It doesn't mean they're trying to do things wrong or even try to hurt us. But it just adds to the more complex problems of when we're trying to solve these indoor air quality issues. So, Dave, could you give us just a little bit of background about yourself, and then we'll just dive right in.
Sure. Just briefly, and first of all, Dave, I'd like to say thanks for inviting me here. This sounds like a great opportunity to share my experience as a long-time certified industrial hygienist. I've been in the industrial hygiene and indoor air quality business for over 30 years. I've got a bachelor's degree in health science, a master's degree in industrial hygiene from the University of Rochester Medical School, and I've got a master's and a doctorate in education, which focused on environmental health action research. So I've really tied my education experience into occupational health and safety, and I love it. It's a wonderful field, and I would recommend it to anybody that is wanting to pursue a professional career that's very rewarding. And so I look forward to talking to you about this very, very important topic.
Thank you, Dave. I think I have just a couple of notes, and really, when I kind of sat down and started this whole thing, I was really very focused on. So, what are the topics that I also want to know? Not just somebody who's brand new to the field, and of course, now we're discovering more and more hazards out there, just because that technology is letting us find these hazards, of course, a whole lot better. Is there any way we could touch on formaldehyde? Let's talk about formaldehyde exposure that we can find out in the workplace.
Yeah, it's like, throwing questions out about all different chemicals, and formaldehyde is one that I have some experience with. And formaldehyde, of course, is a suspect human carcinogen. It's found in building materials. It can be in cabinetry, new cabinets. It comes from overseas. We're not exactly sure how it's manufactured. I was involved with a lawsuit for a big manufacturing company here in the United States, who installed formaldehyde contaminated joists, wood joists in homes. So the new house construction was, when the homeowners moved in, was poisoning them with formaldehyde. So, as an industrial hygienist, we typically do industrial and commercial work, but we're finding now with these hazardous chemicals like formaldehyde, we're finding them in the home. And we have to, go into the home and test for formaldehyde. And we've tested, there's a couple different methods. NIOSH methods. You can use an active sampling pump, or you can use a passive sampling monitor to collect your sample to see what the formaldehyde levels are in the building.
So for a office type area, would you would you recommend a passive as a 24 hours, just to kind of say, well, this is kind of what a average day would look like? Or would you rather almost put a sampling pump on a person and they would just kind of do their everyday day at a office? Let's just say they installed some brand new cabinets, and all of us have seen these gigantic cube farms, and all that stuff. What would you kind of like recommend for a sampling type protocol for that?
I think that's an excellent question, and you're really each individual project is going to be different. So you really got to collect as much data upfront about the case, and about the material that we're evaluating. Why do we think formaldehyde is in the building? Why do we think it's in the office? Are people getting sick, or does it smell funny? usually when we do indoor air quality, formaldehyde is not, or an indoor air quality assessment, formaldehyde is not our first go-to test. But
Hmm.
if we know the product that is in our office contains formaldehyde, then you want to sample. And typically, for a case like that, it's not like an industrial exposure where a worker is handling like specimens of, from a science lab that may contain formaldehyde. So in that case, we do personal sampling. But in an office space where there's not one person that is exposed to the thing, the formaldehyde or the source, or, I'd want to do a survey of the office and set up formaldehyde samplers, area sampling versus personal sampling. In this particular case, OSHA likes to see personal sampling when you're trying to compare your results to the permissible exposure limit. But in this case, an office space, while it is a workplace, we still want to understand, what the exposure is. And you could actually do both, do personal. If you had a complainant, if you had somebody who was sick or didn't, or whose doctor told them, your symptoms are that of someone who's been overexposed to formaldehyde, your company should test for formaldehyde. So then we would do personal samples on that individual. And when anybody's sick, you really want a medical doctor. I'm not a medical doctor, to help us determine what the exposure is, and if this would be a good thing to sample for, because you can sample for hundreds of different chemicals. And we don't like to do the shotgun approach, but if we know formaldehyde's a problem, like in the case of building materials that have been flagged by the manufacturer, we can test for it. And we can also test if there's a suspicion. And then if it's over a certain level for formaldehyde, we wouldn't use the OSHA PEL, right? We would probably use an indoor air quality standard like LEED for formaldehyde. And I'm trying to remember what that is off the top of my head. I can't. I could probably find it here in a second, but it's well under 1 part per million. It's like half a, I can't, I don't want to quote anything. It's in the micrograms per cubic meter range, very, very low. Whereas the permissible exposure limit for OSHA is much greater than what you would expect in an office area, or expect in an industry where they're handling formaldehyde. So to make a long story short, I know I rambled on a lot, Dave, and I see your eyes are slowly going up and down. But I don't know if I answer your question, but you could do both. You could do batch sampling, or you could do passive sampling or active sampling with a pump. And a lot of times we get told what to do. A lot of times our clients, if they're insurance companies, for example, might have a certified industrial hygienist writing us a specification. And the specification tells us what method to use, like a NIOSH method or an OSHA method, for analyzing our samples, and even what type of sampling to do, either batch sampling or active sampling. And the reason, and I think OSHA approves active sampling. Batch sampling, I'm not sure where the approval process is and which is better, but they're both accurate, fairly accurate. Yeah, that's formaldehyde. If you suspect it, we can test for it. We can tell you if it's within, the most stringent standard, and we need to take a long enough sample to be able to do that. And usually we like to take, at least a 4 to 8 hour sample.
And in that case, it's probably a whole lot harder to go back and engineer out the source, because if the source could potentially be the furniture, it's really hard. Have you? Let me think if I can put it a certain way. Have you ever had to go in and just literally abate all of the furniture? And by abate, you just probably just took it and ripped it out and said, all right, we're just going to start over again with a different brand, a different quality, you know, and that's how that we're going to get rid of the, in this case, like formaldehyde exposure.
Yeah, well, I might take samples of the furniture to see if formaldehyde's in it, like surface samples or bulk samples.
Mm-hmm, mm-hmm,
And to see if it's off-gassing the formaldehyde. Is the furniture really contaminated? How would the furniture have been contaminated, through the process of just off-gassing from cabinets? It would be
mm-hmm,
hard for enough formaldehyde to get into furniture, several feet away to contaminate it. And I think that's where your air sampling would tell us. Now, if we found the furniture was contaminated with formaldehyde, and it continued to off gas to a point where it was uh, dangerous or toxic, then yeah, we'd have to throw it away.
mm-hmm,
Um, in the cases I've been involved with, it's mostly wood products that are contaminated, and the formaldehyde off gases. And over a period of time, it will dissipate with a lot of ventilation.
right.
So we ventilate, 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 and you might have to encapsulate. And then they make paints and coatings that are, environmentally friendly and don't off gas and seal the wood product that contains the formaldehyde.
Mm-hmm,
And sometimes that's an option uh, for the homeowner or the office um, manager. But if that's not an option, they may say, I'm afraid, I've got children, I've got babies, this might be a daycare. If it was a daycare, that's a different story, or an elderly home where people are highly susceptible to chemical exposure.
right,
Uh,
right.
so like you say, each case is different.
So I gotta suspect that when people call you, they may not know it actually is formaldehyde. It just might be we have some kind of a odor. Somebody says they have a headache and irritation, and then you almost have to kind of do like the whole the problem is or the problem is not this, and then kind of go through a whole series then, right?
Yeah, and a lot of times we kind of rule out formaldehyde because that's not the problem.
Mm-hmm. Mm-hmm.
Sometimes we don't have to do any sampling. I was on a job the other day where they said that the building smelled like sewer. And can you come in and take some air samples? And I said, well, I can come in, but I'm not sure we need to take air samples. So we walked in, and sure enough, the building smelled like a sewer. So we look around, and what do you think we found?
Probably found dry trap someplace, right?
Yeah, as
Yeah.
simple as that. Right. So we put together a management program for them to continue to fill their floor drains with water. Simple. And people just need a little bit of help sometimes like that. And we didn't have to spend a penny on air sample.
Right, right, right. And so that also makes them feel a whole lot better too, because it's a problem that you could solve as opposed to we tried everything and we still have the sewer smell. So,
Yeah, I get a little bit worried about these snake oil salesmen that try to sell air sampling to customers, because I try not to sell air sampling, even though that's what we're experts in as certified industrial hygienists.
mhm.
Uh, Air sampling is just another tool in our toolbox, and sometimes, we might need a hammer, but we don't need an air sampling pump. It's just we might need a screwdriver, but so we try to keep that in mind, because you can spend a lot of money on air sampling.
Oh yes, yes. Hmm. Hmm. If we could switch gears, I think I'd
Sure.
like to talk about ventilating natural gas systems. So I'm going to try not to give away too much of the whole story, but a friend of mine, one of his friends, had just died a couple days ago, and when they went back and looked at the whole investigation, the whole building came back very high uh, for carbon monoxide,
Right.
and they were really trying to figure out, was it from the natural gas boiler, I mean not boiler, but from the natural gas heater and all that stuff too. They do know that when they were looking at the vents, that the snow had kind of pushed up on the vents. So I don't have all of the data yet that came back, but is there any tips or tricks that you could give in that kind of ventilating of natural gas burning products?
Yeah, well, that's a good point. Well, first of all, you shouldn't have any natural gas burning products in your home or in your house or in your building unless they are ventilated, right? Your
Right,
furnace is required to be ventilated. Your hot water heater is required to be ventilated. And
right,
they have the UL standard and the codes that the HVAC guys that install these things follow. So the ventilation and your code enforcement, local code, your building code requires it. So if it gets plugged up, I mean, it's really our responsibility as building owners or facilities managers or homeowners to make sure our vents for our heating systems are not plugged with snow,
right.
right? Um, and you have a carbon monoxide detector in your building. I I can't think of anything else. You don't want to put a kerosene heater or a propane tank in your house with, even in your garage, unless your garage door's wide open and you got a lot of fresh air. You're going to get sick. And unfortunately, people die every year from that,
Yeah, yeah, yeah.
you know?
So I don't have all of the details, but he did not have a detector in the house. He was also living downstairs in the basement. Just kind of, kind of almost a perfect storm when everything happened. Super, super cold outside. Snow had what they think at least clogged up everything. So
Yeah, yeah. So that's a good message to pass along to industrial hygienists that have a monthly safety or a weekly safety or even a health and safety team meetings. Or a lot of people have um, what do you call them, toolbox talks
hmm hmm
every week. You got to clear those vents on your heating systems. Up north, where I'm from in Rochester, New York, we get buried in snow and it can become a big problem. We hear of this problem every year.
Yeah, yeah, yeah.
Yeah.
So my son is looking at going to school up there now, so we're down here over in the DC area. So we don't get that much snow now. So
No, no.
I've been shoveling snow the whole day. But up there you guys get actual snow. Here it's really light compared to
Comes
up
and go.
there.
It's still cold where you are. I just drove through your area, Washington, DC, down through Fredericksburg. I'm actually in
Mhm.
Florida right now, but we
Oh,
work
awesome.
in Rochester, and I did have a job down here. So I'm actually sitting in 7-degree weather out in the garage where we're living, and I don't have to deal with that snow for a few more days, but
Yeah,
uh,
very nice.
I know
Very
what it's
nice.
like.
Yeah, 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 yeah. So that's why that my eyes are all glassy from shoveling the whole day. So
Well, it's a
I
good workout, then you don't have to go to the gym.
exactly, exactly, exactly. So all right, so we talked about formaldehyde and carbon monoxide. How about one that for household, it's pretty darn common on the East Coast, radon exposure.
Oh, yeah, radon, every state and EPA, they have pretty strict guidelines on radon, right? The EPA guideline for radon, the action level is what?
four pico, 4 picocuries.
Right, 4 picocuries per liter, I think,
Yes.
is what
Hmm.
the unit of measure. And that's one thing is important if there's industrial hygienists or young ones watching it. Be careful of your units. You know, you always want to know what units we're talking about. Liquid, air, solid, mass, volume. You know, took me a long time. I'm not that smart, and it took me a long time to make sure I understand, like asbestos is fibers per cc, you know, lead is milligrams per cubic meter, you know, parts per million. So if you want to be a good CIH, you'll know those units. And picocuries per liter is, like you said, is the units for radon in homes. And so you can, and radon is a gas, natural occurring gas, right? It comes through the ground, through a natural mechanism, and it can cause lung cancer, right? And they say it's dangerous as smoking cigarettes if your radon levels are elevated. So what's your experience with radon?
Well, I live right in one of like the radon hearts of the country here. So I'd say that most of the households are going to have a system on there, you know, a pump and a vacuum and all that stuff then. I know that we just moved into this house, and I think when we had it tested, it came back at a 2, and that was with everything sealed, of course, and all that stuff. And we still went back and put in pump and all that stuff because our plan was that I really like my basement and all of my houses. So I really want to take this one, fix it up, put a little gym in the basement. I got my office in the basement, all that stuff. The kids watch some TV down here, all that. So even though that we were under that limit, we're still thinking, well, we're probably going to have more time down here than what most people do. So we should probably do the best job that we can. So, and the last time I had it tested, it came out at 1.2 picocuries per liter then. So we were able to bring it down, of course, a whole lot then from there.
Oh, good,
So
good.
yeah, for me, if I could really get it down even lower, then I would even do that. I'm not really sure how I would do it at this point, because I do think that I have some coming in from the well and all that kind of stuff too that I have.
Mm-hmm. Yeah, well, if you increase your ventilation in your basement, turnover in your air, if you had some mechanical system to provide you with more fresh air, that might help. But it sounds like you're in pretty good shape. I mean, uh, you're under that action level that we consider, you know, hazardous for living space. Yeah, I'm not a radon installation expert, but luckily, where I live, I know a company that does that work, and I've referred him many times, and he's installed radon remediation systems, and I've seen them, and I've been participated in it in commercial buildings and in apartment buildings and in residential buildings. In fact, I referred him to my cousin who needed a radon system up by Canandaigua Lake in upstate New York. And he dropped the radon levels that were elevated up around 6 or 7 down to where you are, around 2 and
Oh,
less
that's awesome.
than 2. So yeah, they work. You know, they work by taking the gas, preventing it from getting into the house before it gets into the house. So yeah, and then to test it, there's different methods to test it, right? Charcoal canisters, there's e-perm units, there's long-term testing, there's short-term testing. Yeah, and in certain states, well, for example, where we live in upstate New York, the state maintains on their website, New York State DEC maintains the radon readings for every county, household radon readings. So they collect data from households throughout the state, and
Oh,
they
interesting.
actually allow us to look at it. So in the region that we live in, Monroe County, the radon levels are negligible, 0. But once we get south towards the southern tier, like towards Pennsylvania, they start going up. And so, just south of the New York State Thruway, radon levels start spiking, whereas north of the Thruway towards Rochester and Lake Ontario, the levels are very low.
Mhm. Very
So
good.
I'm sure other states probably have, data like that you can look at to see what are the household, average household readings of radon, are they available?
Mhm. I'll have to go back and look for us. I know that I found it for the county, but I don't know if they really broke it down per household. It's like they were almost scared to say this house had this.
Yeah,
Um,
I
you know,
misspoken. I don't mean every household, but per
right.
county. And they didn't identify which house, but they
Oh, right,
identified the
right.
town and the,
Hmm.
not the specific location, but the town within the county and so, yeah, they didn't like say it's Dave Duford's house. He got a 2.5, right? They don't, it's not that detailed, but
Right.
it's enough detail to give you an idea of, is it a risk? Should I bother testing? We had a neighborhood call us just south of the city, and we tested 13 houses. And I'm trying to remember the results, but there wasn't anything surprising. I don't think out of the 13 we tested, we had 1/4, and then we may have had 1/4, and then we recommended, some longer term testing and a retest and found it wasn't a problem.
Hmm. Oh, good, good, good,
Yeah,
good, good. So, Dave, we are bumping up against the clock here.
yeah.
If you could spend just a couple seconds and tell folks where they can find you and connect and get more information about indoor air quality.
Thanks, Dave. I appreciate it. Yeah, again, my name's Dave Duford, Dr. Dave Duford. I'm a certified industrial hygienist, certified safety professional, certified hazardous material manager, and I work for this company, Can-Am Environmental Safety, um, out of upstate New York, www.canam, short for Canadian American, uh, ENV, short for environmental.com. CanAmENV.com, and my email is just the same, david@CanAmENV.com. Give me a call. I'd be happy to talk to you, just like we talked today with Dave. I often get calls, just for questions about the problem, and whether or not I can send you a quote or a proposal. It really doesn't matter to me. I'd like to just talk to you over the phone, and if we can solve the problem over the phone, that makes me feel good too. So give me a call, shoot me an email. I'd love to talk to you about indoor air quality.
Thank you, Dave. This was great. So episode 109 is complete. Thank you for joining me today. My name is Dr. David Ayers. Thank you and have a safe day.
Thanks, Doc.